Steve Brown.
There are some really excellent proposals here, of real substance, actually, and I think they give people hope. And I think it's really important the Secretary of State said people should not need to fight the system. The truth is, Mr Speaker, that when it comes to accessing CAMS services in my area, they'd love to be able to get hold of the system, let alone fight it. As a result, early diagnosis is often what's missing, and then children are falling further down, meaning the intervention they need is significantly more acute. So the government recently announced, I'm pleased there are health ministers on the bench, My Planned Care site to keep patients up to date on their wait for NHS treatment. Now, given many parents tell me they're often told not to even ask about the wait that they face, shouldn't parity of esteem between physical and other conditions demand that the wait for CAMS services is brought into that same place, not so they can just see the national standards, so they can see exactly where their child stands and how long they're going to have to wait?
So, State.
I'm grateful for my honourable friend's characteristically thoughtful and evidenced question. The commitment that the Secretary of State for Health has made in this Green Paper towards the local inclusion dashboards and that transparency so parents can see locally. It's all well and good having a sort of national view of this, but how does it affect me, my family, my child, is an important one in this Green Paper, and I think that transparency will mean reform of the system and CAMS actually delivering to what parents and children need, and that early identification is really important, rather than that long wait where actually, in many ways, you are adding cost to the system and actually disadvantaging that child in doing so, as well as, of course, the Secretary of State for Health's commitment that the health system will look at then resources and provision to make sure we deliver that consistency around the country.
Marshall.